Hi, my name is Mitza, and I'll be discussing what ovarian cancer is and stating some facts that you really need to know about ovarian cancer. So, to start off, does anybody know anyone with ovarian cancer? Okay, so I see a few of you know someone with ovarian cancer. So, today I'd like to actually also talk about what ovarian cancer is, what are the risk factors, and how to prevent it. So don't worry about what you don't know because you will know by the end of this presentation. So ovarian cancer is a tumor that grows on the ovaries. There are actually three type of tumors that will grow on your uterus or other areas of the female reproductive organs. The first one is the epithelial tumor. The epithelial tumor actually starts on the outside lining of the ovaries. These are your ovaries on each side. The outside lining is what become affected of the epithelial tissues. Next, you have the germ cell tumor. The germ cell tumors form from cells that produce our eggs. Next, you have the stromal tumors. The stromal tumors actually affect our cells that help us produce hormones, such as estrogen. Next, we have four stages of ovarian cancer. Stage 1 being the least deadliest, stage 4 being the deadliest. Stage 1 of ovarian cancer actually affects one or both of your ovaries. So we have ovary here and an ovary here. Stage 2 can affect the ovaries along with the fallopian tubes. These are your tubes. And then our uterus, which sits right dead in the middle. Stage 3 of ovarian cancer actually goes beyond the ovaries, beyond the fallopian tubes, beyond the uterus, on into our abdomen region. Then you have stage 4, which is the advanced level of ovarian cancer. That is the most deadliest. Now that we've talked about the stages, let's go on to our risk factors. Risk factors include, but are not limited to, family inherited, or family history, excuse me. Family history meaning that two or more women in your family have been diagnosed with ovarian cancer. Then you have the inherited genes. The inherited genes means that this gene has traveled from generation to generation. Next, you have hormone replacement therapy. Some of us need hormone replacement therapy for different conditions. So, if you are taking hormone replacement therapies, it's best to stop them as soon as you can. That way, it lowers your risk, and it also lowers your risk if you're over menopause or have hit menopause. Next, we'd like to talk about other risks outside of the family genes and also family history. Let's talk about talcum powder. Talcum powder has been a current topic. It's in the newspapers, the magazines, also in the TV commercials on how ovarian cancer may be linked to talcum powder. So we may want to stop use of the talcum powder, according to the National Cancer Institute in 2015, posted on their website. Also, talcum powder increases our risk from 20 to 30%. According to the NCI in 2015, 21,000 new cases and 14,000 deaths are due to talcum powder. Most women are diagnosed at the age of 63 and have stage 3 cancer. Ovarian cancer is more popular in Caucasian women, and then you have Hispanic women, and then you have African American women. It is also stated by the American Cancer Society that one in every 75 women will be diagnosed with ovarian cancer sometime in their life. Women with a family history or inherited genes may request genetic testing, excuse me, so that they can find out if they have a higher risk of ovarian cancer. If they are, and they do have a higher risk, they may opt in to actually have their ovaries and fallopian tubes removed to lower their risk. Other preventative measures would be to stop smoking, get regular exercise, and also avoid things that cause cancer. Also, if you have a precancerous condition, make sure that you're taking your medication as instructed by your physician. Women that have lower risk or how to lower your risk could be pregnant women or women that may become pregnant, breastfeeding, taking birth control pills, having your tubes tied or a ligation, which is laseroscopic burning of your tubes. Then we also have a low fat diet, which also helps lower our risk. Now, to conclude, as I've already stated, we know what ovarian cancer is, we know the risk factors, and we know how to prevent it. The American Cancer Society predicts that there will be over 22,000 new cases this year in 2016, and that over 14,000 of us will die from ovarian cancer. So here are some signs and symptoms to be aware of so that you'll know that you need to get checked by your OBGYN as soon as possible. Persistent bloating, indigestion or nausea, changes in appetite, loss of appetite or feeling fuller sooner, pressure in your pelvic, and lower back pain. If you have any of these signs and symptoms, please don't ignore them. See your OBGYN as soon as possible. Make sure that all the women in your family that you care about are aware of these signs and symptoms and they seek medical attention as soon as possible. Thank you for listening to my presentation and you have a great evening.